Have you ever wondered what actually happens during a code blue? Who does what and what your role would be? Let's go over the key roles during a code. The first role is the compressor. The compressor is usually the first role in a code. Once a patient is determined to be pulseless, we want to start compressions immediately. This role is the most physically challenging, so it's good to switch this role with at least one other person when you need a break. Some things to remember about compressions. Compression should be done at a rate of 100 to 120 beats per minute. Think of the song Stayin' Alive. Compression should be done at a depth of at least 2 inches, and you always want to allow for full chest recoil between compressions. All right, next we have the defibrillator operator. When the team arrives to help the person doing compressions, they should bring the code cart with the defibrillator. The defibrillator or AED should be attached right away to check the heart rhythms, because some dangerous rhythms need a shock fast to try and get the heart beating normally again. The defib operator will follow the device's voice prompts or instructions. They will apply the pads, analyze the rhythm, and shock if needed. Before delivering a shock, the defib operator's job is to make sure no one is touching the patient. You might hear this person loudly say, "All clear," to warn the team. Once the shock is given, chest compression should start again immediately unless the device says otherwise. All right, next we have airway management. As all of this is happening, someone gets the ambu bag or bag valve mask to ventilate the patient with breaths. This can be one person, or sometimes if there's enough people, one will hold the mask with a good seal while the other ventilates. A lot of times, the respiratory therapist will take over this role when they arrive. Some things to remember for airway management: 1 breath after every 30 compressions, and 1 breath every 6 seconds once an advanced airway is placed. And remember to always watch for chest rise. All right, next we have the recorder or the scribe. This role documents everything: the time of the code, who is present, the medications given, interventions, and timing of those. For example, they'll record shock number 1 given at 200 joules. CPR resumes immediately after. They document the rhythms and return of spontaneous circulation. The recorder ensures a clear timeline of events for legal and clinical purposes. All right, next we have our team leader. Your hospital code team is hopefully arriving, and this will include your team leader. The code team leader is usually a physician or an ACLS certified